Hi, guys. It's Beth here from Aging Care Solutions. Welcome back, or welcome if you're here for the first time. As you know, I offer experienced professional guidance and personal experience for caregivers, seniors, family members who are all traveling and navigating the care journey together. So, welcome again. This topic today, you may have heard this term. Many people have. They just don't really know what is a case manager? What do they do? And so that's what we're going to talk about today. I'm going to bring my notes here forward. Anyway, a case manager is a professional, and I've run into these folks many, many times. I've worked with people, especially at the hospital system level, who manage patient care. But there's different ones that can coordinate services, and I think this will be helpful and interesting. So they can help coordinate and manage care for individuals with complex health and social needs, especially older adults. And I ran into many people whose children didn't live in the area, they didn't have children, or they just didn't have family members. Maybe they had one nephew and he lived in California. So these case managers can act as a bridge between you and your elderly parent or your aunt or your loved one for their health and social needs, especially if you live outside the area. So they can do support services, right? I mean, that's really what this is going to come down to, is they can act as a bridge between you and the healthcare providers, offering support services to ensure that your loved one, your parent, your aunt, uncle, your sibling receives the right care at the right time. And, a lot of times what happens is when it becomes evident that someone who wants to stay home, maybe they can do certain activities of daily living, they can manage themselves for certain areas of their life, but then there's others where they may not. Like it may be challenging for them, especially if they have special needs, or maybe they have depression, or they're highly anxious, or they have a diagnosis like a mental health diagnosis of some sort. So basically what a case manager does is that they help typically handle things like doing a needs assessment. So they would come in and they would evaluate this person's medical, emotional, and daily living needs, right? And then they would formulate what's called a care plan. So they can develop like a tailored plan that it's going to include like medical care, any home help that they may need, transportation, and other services that they can create into this care plan to help best serve them to meet those emotional and medical needs, right? They can also coordinate services, so they can connect on your family's behalf or on this patient's behalf with doctors, so they can set up appointments and they can follow up, or they can even attend these visits with them. Therapists, home health aides, any social workers or community resources that this person, this client or patient might be participating in. And then they can also advocate on that person's behalf, right? So they can speak on their behalf. They can, in as far as medical or legal issues or anything like that, they can ensure that their best interest is being represented. And then, of course, they would report back to family members on their behalf. So they could monitor any progress or regularly check in with them. And they can also adjust the plan of care as needed. So say that somebody who maybe has some sort of a diagnosis or an illness, or maybe they are developmentally challenged in some way, their needs are going to change as they age, just as all of our needs are going to change as we age. And therefore, this plan of care to best manage them and help support them is going to change over time as well. Now, there's different types of case managers. There's medical, which could be like nurse case managers. Those are the people that I worked with. So they would often be employed at by a hospital or an insurance company to manage clinical care. And I've seen and met with both of those types. And the one that I had personal care, family contact with, was an aging life care professional. They were also known as a geriatric care manager. And in particular, the one that I worked with was a geriatric psych nurse. So she specialized in helping older adults with age-related concerns. In this case, it was dementia, right? So I had a mom who, in her early 70s, was diagnosed with frontal temporal dementia. And over that course of 10 years of helping her and managing her, I worked with this nurse who helped follow my mother. She would check on her on the regular. She would see her twice monthly. It was covered under her health insurance. And over time, as my mother became either agitated or sometimes combative or fearful or angry, and she had exhibited different behaviors, then they would help her by recommending the best types of medications that could help stabilize her, calm her, and support her. And that was my brush and my interaction with geriatric care managers. And there's also social workers who can also be known as case managers. So they're often involved in like community-based case management, managing emotional, financial, and social needs for people. Some communities where people live, there are professionals coming in and out all day long, and you would never even really know it. They just, maybe they're coming in and they're not wearing a suit and looking all like professional, but they're coming in maybe in scrubs, or they're coming in. My mom's nurse, geriatric psych nurse, you didn't really know. She sometimes wore jeans, or then some days she'd be wearing scrubs, but she always looked, and she always had her ID badge with her photograph and her name clearly on her credentials. And, it's good to utilize these folks when you can, especially, and I'll tell you why, when you should hire one or when they might become most helpful. And that is if you are overwhelmed managing either your parent or your loved one. It could be even a spouse. A friend of mine's parents just went through this. The mother had seriously advanced dementia and had been home the entire time, and the dad was exhausted, and he was becoming ill, trying to keep her safe. He wasn't able to sleep many nights because she was up all night. So, every family's care needs are different. And that's the one thing that you have to know is that, your situation is unique. And so you may need unique consultation for it or the support of various agencies to help you. But if you are overwhelmed by it, this could be a really good solution for you, just to have a care manager or case manager help coordinate things for you. If they have multiple health issues, if they're frequently in and out of the hospital, I will tell you this happened very frequently for clients of mine. And we were referred also in private duty nursing. I was referred many times from geriatric case managers because they knew that person needed oversight, but they weren't managing themselves well. And they would go out of the house and they would get lost. And sometimes they were driving. Sometimes they were just going out for a walk and they couldn't remember where they lived. So having somebody there with them during the day many times helped them. And then at night when they were tired, if they were able to stay home, and safely stay home overnight, then they would sometimes be in a better position because they had somebody there cooking a meal for them, reminding them of their medications, providing transportation for them. The other time that you might want to consider hiring is if you're coordinating care from a long distance, like if you're a long distance caregiver and you really can't be there for doctor's appointments, follow-ups. It's great to have somebody else do all that legwork for you and advocate on your loved one's behalf, coordinate services, monitor their progress, make any changes to the care plan as needed. And, they have a professional eye that somebody who doesn't would recognize things more. They would recognize if someone was getting frequent UTIs, if somebody was recognizing that somebody was not doing their personal care, like not showering. So someone that's going to see them is going to be able to see, is this person actually able to manage themselves, or do they need a much higher level of care? Also, if you're unsure what services are available or how to access them, these care managers and case managers know everybody in their service footprint, and they would know exactly who to call, or at least who to recommend to you that you would touch base with as a potential team member that could help oversee your loved one. Also, if there's any conflicts among family members. So if your parent, say there's several children and everybody has a different opinion about how they should manage dad or mom or anyone really, if there's 5 people, you'll get 5 different responses as to how it should be handled. But when you put that person's safety and emotional well-being and their safety at the top of that list, everybody in that family is going to agree. And a lot of times, if the parent doesn't have resources or money to pay for it, many times with more children, a lot of times people will just pool resources together and drastically reduces the cost. So if you had to throw in, $25 or $50 a month to have a case manager come in and check on your loved one twice a month, it's going to be worth the out-of-pocket cost of, I think they're typically running $100 to $200 per hour for a good private geriatric care manager to come in and oversee your parent or your loved one, especially if they're at a distance. So those are some of the reasons to consider a case manager to oversee your loved one. I think there's a lot of different reasons, and a lot of folks are right inside these buildings. So if you were to call, say, an executive director or the manager at a senior community, a senior independent living, or if they're in a, like an income-based housing, that manager is typically going to know if neighbors on the hallway are seeing a professional from a local hospital or from, a home health agency, or if they're a geriatric care manager and a nurse practitioner or a geriatric nurse practitioner. So there are resources there. So the pros and cons are that, obviously it's going to reduce your stress. It's going to make sure that person is being that things are not going to fall through the cracks. That person's going to be assessed and reassessed and visited on a regular basis and advocated for on a regular basis. So in the long run, by not having them rehospitalized, going into, subacute rehab and incurring additional charges for services that might have to come in, to have somebody there who can kind of be your ears, your eyes, and helping make decisions on that person for that person's best interest, I feel like it's a huge win. The biggest con and only con really is that it's an out-of-pocket cost. But if you think about the cost of having your person manage themselves and what that would look like with a decline with, them especially not managing their finances properly, potentially making donations or taking phone calls from people throughout the day when, they could be at risk for different things. I just feel like it's worth whatever that charge would be. And if your loved one does have long-term care insurance, you might want to consider finding out if this is covered, because in many cases it would be covered. A geriatric care manager or a case manager, especially if they have specialized emotional and medical needs, because it's less expensive for a long-term care provider to ensure some of the services that are coming into the home, as opposed to having them live in a long-term care facility when the time is right. So anyway, I hope this was helpful for you. And if you have any questions or any topics that you'd like me to discuss, or that you have interest of, just leave me a comment. Say, hey, Beth, this is something that my family's going through right now. I'm also going to be putting in my email address, and you're welcome to have a private consult one-on-one with me. I'll put that information in the description on the channel. And I hope this was something that helped you, especially if you're going through this. So I wish you all the very best, and I will see you in the next video.